Hello, and welcome to our webinar today. The topic is Closing the Loop with Virtual Diabetes Care. My name is Barbara Eichhorst. I'm a certified diabetes care and education specialist and a VP of healthcare programs here at American Diabetes Association. I'll be moderating this fantastic session with Dr. Innocent Clement, CEO and the founder of the SIBA Health. Our learning objectives are to define the role of virtual diabetes self-management, education, and support, DSMES, in creating access to diabetes care. We're also going to outline the operational components of virtual DSMES, identify challenges, at the same time solutions to related delivery of virtual DSMES, and finally, we're going to strategize on how virtual care can be integrated into diabetes care workflow. So what is diabetes self-management, education, and support? We know that it's an individualized intervention to help people with diabetes, not just to know what to do, but help them to apply it into daily practice. And it is a reimbursable service that requires referral from a prescriber. And diabetes education is not one-time visit. It really is kind of like medication. It only works when you take it on a regular basis. So we know that the indication for diabetes education is 4 times during a person's journey living with diabetes. Of course, it is a time of a diagnosis, number one. Number two is annually. We want to really evaluate people's clinical needs on an annual basis. Diabetes changes the same time as the condition changes and the lifestyle changes occur. So it is very important to see people's A1C on an annual basis and ask a person with diabetes what's going well or not so well, and then refer to a diabetes education if there is a need to improve the A1C. The third time is when complicating factors arise. So for example, people might develop a kidney disease or depression where they're not able to manage their diabetes as well. So that would be the time to also refer to diabetes education. Even that, sometimes people say, oh, I have already seen a diabetes educator. I know everything that I need to do. But if they're having difficulties with keeping their A1C within the desirable range, that would be also a time to invite a person with diabetes to attend diabetes education and explain to them that diabetes changes as you get older, and then there's new treatment modalities, and then also interventions that you might not have been aware of, or it was not needed at a time of a year or two ago when you first saw a diabetes educator. And the fourth time is during transitions in care. So oftentimes people go to a nursing home or extended living or become empty nesters, go through a divorce, where a situation changes and the environment changes. So that would dictate the need to see a diabetes care education specialist. When we do that, it's also good to explain to people with diabetes that diabetes education is not just about healthy eating or risk reduction. It is really to understand the pathophysiology of what's happening in our body when we have diabetes and how it evolves over time. We also talk to people about how to be active and what they can do to extend their activity level, physical activity, on a daily basis, because diabetes is managed with medication on a daily basis, is managed with healthy eating on a daily basis, physical activity, and risk reduction on a daily basis. We also address medication taking, monitoring, not just of A1C, but also monitoring of blood pressure, cholesterol, and other modalities within diabetes. We address the acute complications, chronic complications, and coping with diabetes. But many times, the distress of living with diabetes can be hard on people living with diabetes. It's just a lot of work that they have to do on a daily basis. And people might have or experience diabetes distress. So the key thing about diabetes education is it's not a one-time deal, it's an ongoing intervention. And we know that there's many benefits of diabetes education, and of course, the improvement in A1C, and then decrease in worsening complications of living with diabetes. Most importantly, it enhances quality of life and decreases diabetes-related distress. We know that there is less hospital admissions and readmissions to ER department, and overall people are eating healthier, have more physical activity, and it also helps with weight management. And finally, probably the most important one is people get a more positive outlook on their diabetes management, and they're able to improve the overall quality of their lives. So now we're going to talk about the virtual diabetes education. And I'm very excited because today is the day that Ciba Health became our 6th virtual provider of diabetes self-management education and support. And they're part of the education recognition family. And that's why I'm very honored to talk to the founder and the CEO of the Ciba Health. And I would love to learn more about your journey as a physician, and how did you establish the need for virtual health, and why are we here today? And tell us a little bit more about the whole journey.
Thank you so much, Barbara. Again, hello everyone, and welcome to this edition. And I'm excited to be here and to share more about my journey, and as well as what we're doing at Ciba Health. My name again is Innocent Clement. I am the CEO and founder of Ciba Health. My background as a clinician certainly uh, allowed me to, see firsthand the challenges with how patients with complex chronic conditions, mostly like diabetes, manage their condition, how they access it, and how care is delivered to them. Prior to Ciba Health, I was also a co-founder of a company that I co-founded with my friends in around 2015. But again, so while I was there, I mean, there's a lot of learning in terms of the frustration, the challenges of how healthcare is delivered today, and so with all that learning, some of the gaps in the care delivery, the challenges led me to start Ciba in 2020, so that we can really build a solution, really that help to transform how we, move away from a sort of reactive symptoms management to really proactive, where we leverage data and understand the root causes of some of those conditions, so that we can put together a solution that is truly what I would call personalized whole person sort of model to deliver care for our members with some of those chronic conditions today, which include type 2 diabetes.
Totally makes sense. And the key word is the personalized care. And that kind of get me to the next step. It is very difficult to personalize it with there's so many different elements of different healthcare professionals and circumstances that are taking place. So let's talk about some practical steps that healthcare professionals can take to overcome barriers to team-based care. So we got a physician, we got a diabetes care education specialist, we got endocrinologists, we got primary care. How do we all put it all together so we are part of the same journey, and we're not repeating the same thing together, but really complementing each other?
Yeah, I mean, it's very important. Like, again, like I mentioned earlier on, the current care model today suddenly is very siloed, as you know. The goal of Ciba today, or the mission, is really how can we bring everyone together around the table with a patient in the middle. So we call that member or patient centric, right? And really the goal is to really see how can we all work collaboratively to be able to support members with some of this chronic condition, empowering them, leveraging their data, and also really be able to share data in a way that remove the silo and really helping with that fragmentation. So you have a doctor, you have a dietitian, you have a health coach, you have an endocrinologist. What we've done is build a technology, a platform that is fully integrated with connected devices, which include CGM, that also looked at their weight, their blood pressure, all within the same platform. and allow all the care team to be able to coordinate so they share data real time. So this allows us to move away from this fragmentation and to move to really integrated platform that provide data within the patient and how we can continue to support them to deliver this whole person personalized care model that is member or patient centric. And so I think it's really, really very important because patients actually struggle with how they can manage their condition because diabetes management is not just about the numbers, right? It includes emotional support. It's also a daily and lifelong sort of way to manage it. And with the current care model, that certainly had created a lot of challenges with how this is delivered. And this is what CBA is addressing: the fragmentation, driving better engagement, empowering patient, and then also empowering providers to work as what I call collaboratively as a team to support members to ensure that the members have access to solution that can help them to support them either emotionally, also really to be able to leverage data to allow them to be able to track trends and see how well they're doing. And that would also really allow them to move away from what I call the reactive to really more proactive sort of care.
Yeah, make it easier for a person who living with diabetes to really navigate the whole healthcare systems. It's everything is in one place and we are communicating effectively. Makes a huge difference.
Yeah. So the power, I mean, like you said, I mean, I wanted to also highlight, the power of team-based care, right? And really with integrated care. What we've learned, again, is if you are able to have all those people together, that allow you to really have improved outcome dramatically for everybody that is surrounding this patient, instead of, you know, working in parallel, but you work as a team. And then so when you have a doctor, a dietitian, and health coach, a behavioral therapist or specialist, even health coaches that can collaborate within this shared data environment, really that continue to review patient, moving away from that silo and align and sort of intervention, but looking at data real time from either remote patient monitoring capability, that create a lot of what we call consistency for each member, right? And everyone on this the care team see the data real time. And when you see that, you understand how you can better support the patient goals, and then that allow you to move them into a direction of where they need to be at, right? To support them as they continue to manage their condition. But also it builds what I call trust, because this is something that is also lacking in the current care model today. Trust is really completely missing. So when you build trust and they trust you, that also allow them to stick to some of the recommendation and advice and how they can better support themselves.
Sure, and I think the key word here is also real time. With diabetes management, it's like when things happen, they need to be resolved right now. It's not when I have a low blood glucose, then I'm going to go and open my booklet and then try to figure out what to do about it, because people need to react, problem solve in real time. So being connected to the appropriate devices, CGM, and have access to real-time solutions make a really huge difference, because we're not being reactive a day or 3 or 4 after. We're resolving it at the time of this happening. And a person with diabetes is able to learn from his or her own experience. They don't have to learn from the books or textbooks. They're like, oh, I noticed that I'm getting a blood glucose when it's, when I'm stressed out. They're identifying the patterns and they're proactive about doing things differently as a result of this. So the data is teaching them on effective solutions instead of, me as a diabetes care education specialist or you as a physician, a week or two after, it's like, oh, what happened at that time? Let's talk about it. People already forgot and it's no longer an issue that needs to be solved. So why do we want to teach something to somebody that is no longer applicable? So I love the fact that it's a real-time solution. There is also a teachable moment for that person, and that a lot of those moments are happening, and then that's how people learn throughout their journey with living with diabetes. It doesn't have to happen in a week or a year. They have plenty of time to really get comfortable with their diabetes management, and they are learning on an ongoing basis.
Oh, I mean, again, you nailed it, right? And this is really what we meant by when we say closing the loop, right? And really, it's about creating that feedback mechanism or feedback cycle between data, that education, and the care we deliver for each members. And so every member's insight turns into an action because the data and the technology, what it does is it helps with some of this behavior lifestyle modification because it also sends them nudges. They see trends, and then you see a trend that your continuous blood glucose it's probably not where it should be. So you leverage all that and allow you to begin to make some changes around your lifestyle. The CGM creates that feedback loop. The data from the scale or the blood pressure also allow you to see trends, you see your progress. And when you collect all that information, the technology allows you to take that, harness that, and create insights and then provide, personalized nudges based on what the technology is seeing. So this allows us to continue to close the loop, not just educating, but really empowering members.
Exactly. And then for us with diabetes education, the closing the loop also refers to the fact that a majority of people living with diabetes who are eligible to receive diabetes education are not receiving it. So making it available virtually, no matter where they are in US, it allows them to get that intervention. Otherwise, they would have to get in a car, drive to the place multiple times, come home. It's just so much better to receive that education at the comfort of their own homes, where we can kind of talk to them, go to your kitchen, figure out what you have, to eat right now. So it's like more in a more appropriate setting where life takes place, not necessarily in a hospital or clinical setup where people feel like patients. People feel more like they're human beings living their life, and we're helping them to integrate that the healthy lifestyle and other aspect of disease management into their daily routine. So I love the fact that it's really being provided during the everyday when they're actually functioning, and also at the comfort of their home. And finally, no matter where they are, even in remote locations, they are able to receive this important intervention.
Yeah, I mean, you brought up a very important point, Roman. Again, I would always want to re-emphasize the technology piece, right? So technology, it's not just a technology. What it does is access convenience. And so for us is technology is actually the connective tissue here that brings in everything together to provide you access, to provide convenience. So what it means, we're meeting them where they are, because that's also very important. A lot of times, very often, people would have to drive 3, 4 hours to have access. But when you have technology that also provide all that connectiveness, that gives you that data, that provide you some sort of decision support, that guide, clinician, looking at the remote patient monitoring capabilities, and they keep members connected. That allow you to be able to predict, looking at each member data, and identify a risk before problems escalate, right? So, and once you're able to identify them, there are two things you can do. It's either outreach, right? And then the next component is providing them with where they should go and recommendation. Maybe they need to be evaluated. There are certain risk factors that you're seeing. So this is really important as we embed technology. But the most important thing I also want to highlight here is the technology would not replace the human touch. It only helps to amplify it. It helps our clinician to deliver more empathy, not less, because they are better informed and less, burdened by manual tasks that you have to do. And so it's also important to highlight, this key component of how you provide that convenience, access, meeting members where they are, either at home, even at work, during their lunch break and all that.
It's a dietitian. I can tell you that whenever I'm working with people with diabetes, sometimes I hear, "Well, I don't need you anymore because my CGM tells me if my blood glucose is high or low, and my trends, and I understand what it is." So I had to reevaluate my value that I bring to the table as a clinician. If the technology is guiding them, what is our role? And the key is our role is to still there is an element of education that is needed. Yes, an apple and Twinking can bring up your blood glucose the same way, but why to choose the apple in the long term, and then helping people to make those long-term investments in eating healthy, let's say, or being active and so on. So there is a different value that we bring to that person now with the use of the technology, because technology is not going to replace us. It's going to really add and aid in this whole journey in improving the clinical care outcomes and overcome the therapeutic inertias that might be happening throughout the whole journey. So now let's talk a little bit more about employers and payers connection to a virtual diabetes care. Tell us a little bit more about that.
Yeah, I mean, as you know, today in the US itself, today, chronic disease specifically is costing over 80% of our healthcare dollars today. And employers that are self-funded, employers that are fully funded, health plans, TPAs, health system are struggling with managing the cost. And not just the cost alone, but thinking about how can we have a solution that would help us to improve the quality of life, to help us reduce the cost, but to reduce unnecessary healthcare utilization, emergency room visits. So a lot of them are looking for solutions similar to what SIBA offers today. One that provide the convenience, which was something that you mentioned earlier, and also access. So which means they would call out less often from work to say, I'm looking to go see a doctor or find where I can find a solution. What SIBA, similar to what SIBA is offering, maybe they have to go to a brick and mortar. But we're not discouraging that. But so the employers are really looking for innovative solution that can address that. And we have a lot of employers today that come to us and say, hey guys, we have 5% of our population that is costing us about 50% of our healthcare dollar that is set aside for everybody. We have to do something about it. We have to look for a solution that has proven to deliver value, better outcome, better quality of life, access. And so when they come to us, we walk them through what SIBA offers today. We said, our model today, it's a combination of human and technology that can certainly help to address a lot of your pain points around, managing your members or your employees or associate better with a solution that is virtual. So that really get them excited. The question they ask is, how can we trust your solution? Do you have data that validate and supports, your some of your claims around better engagement, better outcome, better ROI, right, and access? When I talk about ROI, again, employers and payers, even healthcare providers today, they are very smart now. They're not just looking for solutions that is really, you know, promising, right? Make promises, but rather a solution that actually have concrete data or have validation to support, the claims you make. So the claims could be around better engagement, better outcome, better ROI. And they're not also looking for a point solution. They're looking for a solution that delivers value for the whole population, right? And similar to what SIBA offers today, where we look at not just a patient with the diabetes, but what else? Are there any comorbidity? Are there any risk factors that the patient needs support with? So we want to ensure that we have the solution that addresses that. And that's where the value is. The most important thing is building that ecosystem, right, where better health outcomes translate directly into financial sustainability for either the employer or even the payer connection.
So talking about the human factor that you have mentioned, Innocent, let's talk a little bit more about what issues do people with diabetes face with navigating in the very complex healthcare systems these days?
Yeah, I mean, there's a lot of them, I would say. One of them is around fragmentation, right? I mean, really, because access to care today, it's one thing. The fragmentation is also another thing. A lot more often than not, what we've seen is members with some of this condition today would have to actually have access to multiple providers. And the challenge is most of them don't have that sort of connection where they're able to share that data all the time, and it becomes a little bit of a headache for patient. It becomes overwhelming, even when it comes to the education. So sometimes it's almost like in a silo. So that leads to a lot of emotional fatigue, e.g., patient becoming like, oh my God, what am I doing to myself and all that. And so because of some of those challenges that I mentioned around fragmentation, limited education, emotional fatigue, that led us to really build SIBA so that we can really build a solution that addresses a lot of those challenges, where we bring in the medical precision, or most importantly, the human connection that we bring into that. The second element is the behavioral health integration that we provide to support patients that allow them to build confidence and really move away from that self-blame that we begin to see in members of some of this condition today. And the last one that I think I want to also mention is around the robustness of data insights, right? So data insight, it's very powerful. It's a powerful motivator. It allows you to begin to think a little bit different because you have your data in your own hands. You feel like you're in control. You get insights. You get nudges that ask you to say, hey, go for 15 minutes walk, right? I know it's tough. So when we provide them connected devices that include like Fitbit, the CGM, all that has the data together and providing you with the insight and those nudges has allowed us to address a lot of the issues that we've seen mostly around patient, dealing with this chronic condition today.
Makes sense. So, talking about technology, and I mentioned it before, I'm going to mention it again because we're very proud of CIBA Health becoming our sixth virtual education recognition program. How does it align with diabetes self-managed education and support?
Well, it does in a way that I think I talked about that earlier today, but the technology is taking that data, harnessing the insight, and providing that to the patient. So if you provide a patient with education, it shouldn't be a one size fit all, right? It should also really leverages that unique patient data because no one patient is the same. So you have a patient with A with type 2 diabetes, a patient B with type 2 diabetes. The challenge today we get in the current care model is the sort of a one size fit all. Everybody gets the same thing. But the technology allows you to take insight, individual data, to be able to really proactively provide that to each patient based on their unique situation, right? So, and this is where, when you look at providing education, you have a library of all the materials that are there. But the way you make it so impactful and powerful is really taking individual data and analyzing that with the technology and providing insight. And that feels so personalized. And if they feel that they truly, truly understand who they are, given their unique situation, where they are, that really helps to continue to drive the commitment to continue to be part of this and leveraging the importance of that education. Like you said, it's really missing, but really technology really brings all that as a glue to allow for scalable solution, allow for personalization, allow for a solution that empowers everyone, and then put you in charge of your own health.
Of course. I love the connective tissue because it gets us to a discussion about the outcomes. How is the connective tissue creating those great outcomes?
What we've seen over time, I mean, I will give you a very good example of a member who had been dealing with type 2 diabetes for close to 15 years now. And it's the same sort of care that they get, what I would call a standard of care today, right? And what Wasiba has done, this employer, within 6 months, saw his A1C level drop below a 5.4. Why? Because you have a solution that really helps that member. From the member's point of view, is he has the trends, he sees the data on his or her cell phone, and that allow them to leverage that and make a different life choices. And also, they have the dietitian who is also putting together a nutritional plan or a diet plan specifically based on this unique patient data. So we've seen significant improvement because technology empowers you. It allows for lifestyle modification, behavior changes. We've seen significant 3.8 A1C reduction across members who actually stay consistently educating themselves, but also looking at the technology that's empowering them to make the right choices. And over time, we've seen over 30 pounds weight loss. I mean, for members who actually adhere and stick to a lot of this plan within 12 months, we see significant impact on their weight. We've seen, members who actually, reduce the number of medication. But it's also important to also highlight the importance of adherence, right? So the technology really also helped them to adhere, to if there's a medication that were prescribed to them, they adhere to them. and to know when to take them, sends reminders and all that. And this really had led to sort of proof points that we have as a company. And when we talk about our data, our outcome, it's not just promises. These are data that are truly, it also speaks for itself, right? And this data is validated by a third party who look at our overall data and measure that across A1C improvement, their weight, as well as medication adherence or better management. And also, lastly, again, for either payer or an employer who is paying for the solution or providing benefits for the employees, we've seen significant ROI, which is about 1.93 across members who actually go through this CBUS platform. And it's beyond the numbers. It's just really, really about individual stories that matter the most, right? And people who regain energy, confidence, and control of their health years after of frustration, really, that's where you see the power of this sort of solution.
Definitely. I love this. Success means seeing patients regain energy, hope, and an independence. When people feel better about themselves and they have more energy, they're doing better. And then they're able to add up additional things on a daily basis to becoming even better and healthier. It's very difficult to do all of those things that we ask people with diabetes to do when they have elevated blood glucose. They're tired. They don't have that energy. And meanwhile, we tell them, start walking more, do that. It's hard. It's physically hard. It's almost sometimes impossible. So when they do, do one thing better, then they feel great about themselves because they're able to achieve. They're not being judged just by the numbers, and that's not all we talk about with them. People with diabetes are often tired with just being, focus on the numbers, how you're doing, that kind of stuff. That personal touch, where we have that intervention with them, where we celebrate the successes, and with their coaches, makes a huge difference because they don't feel alone and they feel acknowledged more than just having a medical condition. So I love the statement that it really gives them hope and independence.
No, absolutely. And that's you actually nailed it. That's really what we hope for, really. Again, it's you empower them to be in charge of their own health and really allow them to begin to see the impact of decisions they make and how they're improving. It's certainly powerful.
So even though I think that we are living in the future right now with all of the technologies available and
Yeah.
personalized care, what's ahead of us? Where are we going with this?
It's really excellent. And I love that you talk about the future is here, right? And the future is today, it's now. What I see when I think about the future, I think about three keywords that comes to mind. One of them is personalization. Two, predictive, which means you are predicting risk factors before it becomes a problem, where you leverage all that data you collect, right? So looking at the trends over time, you're able to predict, you're able to identify that and proactively reach out to members and see how can you better support them. But the last component is the human. You will never take away human from healthcare because what it does is the technology helps to amplify what they can do. It helps to also deliver empathy, looking at the unique patient data. This is where personalization comes into play. The predictive model allowed them to also see specific trends so that they can proactively reach out to members and see what can they do to support them. What are they doing that is different? You take a picture of your food that you ate today, you upload that, and then the technology analyzes that information, looks at the trends, it looks at certain food or nutritional component of what you're eating that is causing problems and be able to help you and provide recommendation and educate you in how to either eat them in moderation or maybe how to completely even eliminate that if it's possible. We also know that you can't completely and say, oh, you have to go on a vegan diet or you have to go on a keto diet, which is obviously not sustainable, but you want to have practical steps. And the practical step is, the personalization, looking at every member data, looking at data that predict certain trends based on an individual's environment, the unique situation, and how you amplify the human, where you have a health coach or a behavioral therapist making outreach based on data. And so it's all about data. And this allows us to even be more what I call deliver a tailored intervention for every individual. And we're also well informed by continuous data, and that allows us to support what I call compassionate and human relationship as we build those with our members and build trust.
Definitely. And the bottom line, data literacy plus empathy equals the next decade defining the skills. Love that. So, what are the key takeaways for us to conclude with and to take us into the future?
Thank you again. I think if there's one message I hope to leave with today, it's what you guys are doing. It's not just DSMEs isn't just about educational program. It's the foundation of a lasting behavior change. When we combine technology, data, human connection, it becomes a powerful force for better managing, empowering patients with either chronic diseases. Type 2 diabetes is certainly one of them. And I would say what we do here at SIBA is we're proving that precision health, empathy can coexist. And that together, they can change the lives of our members with this chronic condition.
Fantastic. So I want to thank everybody for joining us today. We value your time and dedication to diabetes self-management education and support. And I want to celebrate Innocent and SIBA Health and becoming part of ADA's family education recognition programs and really creating access to diabetes education for all of the people within the United States. We are also providing you with our emails, both for Innocent and I, and we look forward to hearing from you in the future. This concludes our webinar.
Thank you. Let's keep pushing the boundaries of what's possible together.
Yes, definitely.